Okay. Hi, everyone. I'm Dr. Jaya Daptardar, I'm an Ayurvedic doctor, healthcare executive, a writer of books, speaker, founder of Jaya's Herbal, and CEO of Active Ayurveda and Yoga LLC. So, welcome to my show, Medical Queens Got Talent. This show is dedicated to women in healthcare. And it is about to provide knowledge, motivation, and empowerment. So today's show is very special. It is special because today we are celebrating Women's Day. This month is Women's History Month. And 2022 theme is women providing healing and promoting hope. So this theme is a tribute to the case workers, caregivers, and frontline workers during this ongoing pandemic. So our show is a tribute to the healthcare workers, caregivers, frontline staff, and emergency workers who lost their lives and who have been dedicated to continue to work during an ongoing pandemic. So our tribute to the families who lost their loved ones in the pandemic. Today, we have our guests, Dr. Hetal Gaur and Dr. Shobha Jagadish. They are our keynote speakers and talented medical queens here. They were interviewed with us last year in my show. So welcome to Dr. Sheetal Gaur, who is OBGYN, and Dr. Shobha Jagadish, internal medicine. So thank you so much, ladies, for joining our Women's Day special today. So first, I welcome to Dr. Hetal Gaur. She is board certified OBGYN practicing in Englewood, New Jersey. She has her own medical talk show on ITV since 2010. She also has a political radio show. She has won multiple awards as a top doctor, top 10 GYN Surgeon Award, Compassionate Doctor Award, Patient Choice Award, International Women's Award for Balancing Career and Family, International Academy Award in 2017, Rising Star Award in 2016, Nari Udami Award in 2018, Top 500 Gujarati Worldwide KAIT Award for Women Entrepreneurship in 2021. She has authored multiple articles on WebMD and peer journals. She has instrumental in starting free health fairs in Bergen County and sits on multiple nonprofit and charitable organizations. She's a medical director and owner of Better You Medical Spa, CEO of Health Media LLC, and medical director of Women's Own OBGYN. So Dr. Gaur sits on New Jersey's statewide advisory commission on minority and multicultural health. Dr. Gaur is a president and founder of US chapter of FOGSI, Federation of OBGYN Society of India, and president of AAOGI. So we are so fortunate that we have Dr. Gaur here today.
Thank you so much.
Thank you very much for joining. So our viewers are probably waiting for you for your talk today. And I'm also excited.
Thank you so much, Jaya. And it's nice meeting you through Zoom, Shobha. March is always a very special one because it's an International Women's Month. And even though we celebrate woman power almost every day, but it's still nice to be recognized. So as you have asked me, Jaya, you want me to talk a little bit about menopause. So menopause by definition is meno means menses, pause means stoppage. So it's when the stoppage of menstruation happens, it's called menopause. it kind of tells us that's the end of the reproductive era for a woman. There were lots and lots of bad theories in the past. They used to be stories about women getting possessed by spirits, and that's why they went crazy, their period stopped. So there was so much confusion till scientifically the hormone testing were done and the process of perimenopause leading to menopause was explained. So even in Western culture, there was lots and lots of theories about menopause linking different aspects of behavior of women to non-scientific causes. Anyways, we've come a long way. Lots and lots of women leaders have said that if at all there is a good time for a woman to leave, is now, right? We have such amazing improvement in technologies, diagnosis, management, as well as the stage is really well done right now for women, even though we have lots to catch up, but in political, in industries, in enterprises, women are leading. So lots of us have experience in late 40s, early 50s, changes in our menstruation. It can start becoming heavy to irregular to very light to very heavy. So it can happen in any ways. Some people get it less frequent, some get it more frequent and heavier. These are the sign that the ovary is not responding to the stimulation by the hormones. So there is a hypothalamic pituitary ovarian axis along with the thyroid, and this controls how women's hormones get regulated. When the ovary is not producing enough estrogen because there is lack of ovulation, the FSH, LH, which are the stimulating hormones, starts going up. So this hormonal fluctuation of high FSH, LH is responsible for some of the moods, some of the hot flash that woman experiences. So that's why I said even before the period stops, this hormonal variation is causing women to have this mood changes and menstrual irregularities. The brain is trying to kind of whip the horse, which is tired, to see if whatever juice it can get out of it. So that's why the FSH, LH is rising, trying to stimulate the ovary. That way it will produce the estrogen and progesterone. But eventually it gives up. There is no ovulation. There is not much hormonal production. And then those hormonal variations, the peaks and the troughs settles down. And that's when the moods and the hot flashes settle down. And then woman is back to being calm and much better control of the hot flashes and mood swings. So that's kind of leading to what happens inside, right? So there are psychological, there are physical changes that are associated with menopause. A lot of us sometimes get memory losses. We have difficulty in sleeping. Now, sleep disorders can be because of few reasons. A is because of hormonal issues. B, because you're having a hot flash, you are completely drenched, it disturbs your sleep, you have to get up. So those are the few things leading to lack of sleep, leading to fatigue, tiredness, irritability. Emotionally, we get ups and downs, like some of us get more emotional. We see a movie or a play and we start crying. So those are emotional changes that happens. Unfortunately, for some of us, it's the time that our daughters are going through puberty at almost the same time. So those are the changes that you are going through, your daughter is going through, because puberty is the other extreme of reproductive age where your hormones are again up and down trying to stimulate the ovary to produce the eggs. So that's kind of sometimes becomes a very difficult situation in the family because you're going through changes, your daughters are going through changes. So physically, what happens? Because estrogen is responsible for stimulation of elastin, for keeping the vascularity, to keeping our skin tight and youthful. When the estrogen level starts going down, we see laxity getting reduced. So you see wrinkles, loose skins, our breast starts sagging. There is a abnormal distribution of fat now. So instead of pear shaped, now we start becoming apple shaped. The major brunt is, of course, on the reproductive organs, especially vaginal area, because it's so dependent on estrogen to keep its vascularity, for secretion, for elasticity, and that's lost. So what happens because of that, there is atrophy, vaginal dryness, loss of elasticity. Also the urethra, which responds to the estrogen, now there is no estrogen, so the cells become flatter, and that makes you more prone for urinary tract infection, because now the urethra is more mobile, because there's no connective tissue. People tend to get urinary incontinence, which is called stress urinary incontinence. Some people develop urge incontinence. So these are all the physical manifestations that can be seen. Hormonally and metabolically, it also affects, because now your cholesterol profile changes, your triglycerides, your LDL, that ratio changes, your HDL, which is a good cholesterol, starts going little down. All this makes women catch up in the heart disease to men. And the symptoms are a little different than men. So we sometimes might have little heaviness on the chest, not complete sharp pain like my men kind of manifest as myocardial infarction. So that's the changes with cholesterol. Our glycemic control gets difficult. Our hemoglobin A1C, we become more prone for diabetes. Also, our bones take a brunt of it, because estrogen is responsible for transferring calcium. It works as a vehicle to put calcium inside our bones. And now if there's no estrogen, even if you take calcium, it's not going to go into the bones, because bone is a highly functional unit, right? There is constant remodeling happening. There is osteoclast and osteoblast. Osteoblasts are making the bone, osteoclasts are destroying the bone. But now that balance is changed. There is no more building, but the destructions continue. And that's why it makes women more prone for osteopenia, osteoporosis. So these are some of the changes that are happening, and a lot of symptoms are due to these changes, and our management depends on all these changes. So we tend to be still very conservative as far as hormonal replacement therapy. We are still very conservative about management with high dose hormones. So what usually we tend to do is we treat the symptoms, right? So if you have hot flashes, we try to do change in the lifestyle, wear layers, try to take cold baths, exercise before sleeping, because it's releasing endorphin, oxytocin, and then you tend to have a better sleep. We have some natural, I wouldn't call hormones, but natural products that we like to give, black cohosh, ginkgo biloba. These are some of the evening primrose oil that I would like to give my patients before giving them any sort of hormonal treatments. If they have vaginal dryness, vaginal atrophy, we tend to give them first a vaginal lubrication through lubricants, maybe just vaginal estrogen use. If that doesn't work, we have laser treatment, radio frequency treatment that increases the elasticity and secretions. We now have vaginal stimulation with radio frequency to develop pelvic floor muscles that helps with the incontinence. We do radio frequency with microneedling in the vaginal area that kind of stimulates the collagen, stimulates the secretion, and that helps women with incontinence, with atrophic vaginitis, painful sex, decreases urinary tract infection, and of course helps with incontinence. Lastly, if need be, we definitely can give as needed bioidentical hormones, regular hormonal estrogen plus progesterone is needed if there is a uterus. If a woman doesn't have a uterus, if she's had a hysterectomy, unopposed estrogen in a low dose is okay. But this all has to be monitored with your OBGYN, with your internist, keeping an eye on the, your cholesterol, your risk for heart disease, your risk for breast cancer, your risk for blood clots, and then we come up with a plan and manage. So we can talk a lot about menopause. It's a huge topic, but I just wanted to give a little nutshell about what is actually happening internally, physically, mentally, and how we can manage all that. If there's anything else, Jaya, you want me to cover, let me know.
I think you covered almost everything.
Thank you.
So thank you so much in covering everything in a little bit of time that we had. And again, it's our pleasure to have you here today.
Thank you, dear.
You. So do you want to give any information about your clinic and
Sure.
your spa?
So I'm a board as Jaya introduced, I'm a board certified practicing OBGYN. My medical practice is in Englewood, New Jersey, which is very close to George Washington Bridge. And my medical aesthetic practice, where we do everything and anything in aesthetics, starting from Botox to fillers to microneedling, radio frequency, liposuction, muscle building. My specialty is OBGYN. So we do lots of GYN aesthetic procedure, which not too many people do it. We do treatment for laxity with microneedling. We do intravaginal microneedling with radio frequency. We do lasers intravaginally. We do scalpless labioplasties, hyperpigmentation treatments, lifts, getting rid of the pubic fat area, loss of libido, erectile dysfunction for men, we treat with the ultrasound treatments. There are multiple treatments. We do the face, liposuction, cool sculpting, sculpture, pelvic muscle development. As I said, it's a very special instrument and technique we have. We treat for incontinence. And lastly, we do ultrasound treatment for facelift. So we do what we call as scalpless or asurgical facelift with the help of ultrasound waves, radio frequency waves, Botox fillers, and peels. We do laser facial. So the list goes on and on. So if you guys are visiting, I have one office in Englewood, one in Jersey City, and we're going to reopen our New York office soon. We had closed it for pandemic and we'll be reopening that. So thank you, Jaya.
Thank you so much. It's so much information, and I learned a lot of new techniques as well.
Thank you.
So thank you again. Our next speaker is Dr. Shobha Jagadish. And she was also one of the interviewer in our show in 2021. So Shobha, welcome to our show again. And Dr. Shobha has been in practice for more than 20 years in Connecticut. And she started her training in India, followed by UK, where she received MRCP and further education in United States. Her journey started at the Cleveland Clinic in Cleveland, Ohio, and she has been in Connecticut for last 13 years practicing with Griffin Hospital. She has been an internist passionate in managing multiple chronic illnesses, which include diabetes, hypertension, and many others. Her recent interest and focus has been obesity, given its root cause in various illnesses and complications, which can all be prevented and treated. And Dr. Shobha's today's topic is obesity in women.
Thank you so much, Jaya, for including me today, especially given that it is the month for women particularly, although every day is Women's Day, I think as Hetal mentioned, particularly this month. And obesity is a very, very dear topic to me. I was always interested, but I think now over the last few years, there's been so much advancement in it. And one of the reasons being it's connected to almost every illness most of us have. And particularly as Hetal already started the conversation, in perimenopausal and menopausal women, we see that becoming more and more commonly. So I'll dive straight in because of limited time. So first of all, what is obesity? Obesity is excess body fat. I think it's loosely used in the incorrect way sometimes. So there is a definition for it, and there's a certain weight and certain parameters you have to fit in order to fulfill that definition. So typically the calculation is done using kilograms by meter square. And normally what is normal is between 18.5 and close to 25. And as 25 goes up, it becomes overweight. And from overweight, we then become obese. Obese is when the body mass index number hits 30. And then severely obese is 40. So there's mild, moderate, and severe obesity, 30 BMI, then 35 is moderate, and severe is 40. But honestly speaking, from the time we start gaining weight that should not be gained is when our journey should start. We want to try to avoid and prevent getting to that stage. And for each and every stage, there is a method and there are ways we can prevent. And there are also ways that we can treat now. But before I continue more about that, I just wanted to complete the definitions. The body mass index is not the only way to define, because this can be skewed in people who have a lot of muscle mass. So the other, some people feel is even more important is your abdominal girth, the inches of waist. So more than 35 inches in women is considered part of the definition of obesity, 40 in males. But in Asian women like us, believe it or not, more than 31 inches, our risk goes up for all complications, which I will speak about earlier on. So for example, even amongst Asians, South Asians, or any Asian race, above 25, you're already overweight. So up till 23 body mass index, and once that goes up, that itself is overweight, and 27 is what we call as obese. So honestly, even I was surprised when I started the endeavor. Many people who I would never have thought in my mind are overweight and obese are medically overweight and obese, which means it's a very large population. Right now, obesity in America is about, actual obesity is 40%, but if you include overweight and obesity put together is more than 60%. And exponentially, it has been getting more and more since several years. And of course, there are various reasons for that, for excess body fat. The most common being our lifestyle. So I'd like to define the risks that obesity poses into reversible and irreversible causes. So irreversible are, you have no control over some things. Sometimes you have a very strong family history. You have hormonal imbalances, like for example, leptin resistance, and medical conditions like polycystic ovarian disease or Cushing syndrome, to name a few. So a lot of those things are reversible, but genetics cannot be reversed. So those things, which is not a large percentage, but a very small percentage is irreversible. And most of the causes can be changed. And that includes, number one, lifestyle choices we make. The most important is the food we consume every day. Much more important than exercise. And I'm not minimizing exercise, because exercising is important for health in general, moderate exercise. But the types of foods we eat, more and more as we have become modern society, processed food, high caloric food, eating out. So that has become more and more common in our busy lives. People tend to cook less and try to eat more fast foods. And with that, the consumption of vegetables and fruits have in general declined. And all of those are things we can slowly reverse by improving our diet. Other things are, socioeconomic causes, many socially and economically, as most other issues in the world. So lower socioeconomic status would mean that obesity is much more common. Many medications per se, apart from lifestyle, can increase fat in our body. And those even include, surprisingly, or which may be surprising, are diabetic medications. Insulin itself, even though the irony is that obesity is the cause of diabetes in more than 80%, the treatment insulin in itself promotes weight gain. Other medications which are commonly used, like glipizide, glimepiride, they come in a certain category. Steroids, commonly used for various medical conditions, that can cause weight gain. And as I alluded to earlier, age in itself, as we get older, our metabolism slows down. We tend to move less. If you compare to how much activity we do unconditionally as we get older, is much less than when we were younger. So all of those factors come into play. But one of the most common things I see in women is that after pregnancy is when people start gaining weight. And that's when most of their journey starts. And they say they were fine, their weight was fine. And most of it is, again, coming back to the dietary factors. And everything I spoke about, it's all also connected to hormones. I don't have a lot of time to speak into details, but it also is part of the thalamus, which is part of the brain. And there are hormones that control our hunger and satiety, like ghrelin, leptin, insulin, to name just a few of them. But why is it so common? Because why am I talking about obesity today? Is because of the complications that are so common, which include exponentially heart disease, much more common in women as weight goes up. Life expectancy, even if you do not have a medical condition associated with obesity, is 8 to 10 years less than the average person who does not have excess weight. Cancer is 20% higher. That includes every cancer, not every, but most cancers we know about, particularly breast, ovarian, endometrial, cervical, pancreatic cancer, colon cancer, to name a few. In addition to heart disease and cancer, and diabetes is one of the most common illnesses, which is absolutely reversible. You have fat deposit in the liver. We call it also known as steatohepatitis, or NASH, we call nowadays. Fat deposit can lead to complications, including liver damage. And now we see more commonly now, people are ending up in severe liver disease and cirrhosis, which in the past was thought to be only alcohol related, but not so much anymore, just pure fat deposit, which is again as a result of obesity. Sleep apnea is a complication of obesity, which is again reversible if you lose weight, where the fat deposit in the neck area leads to obstruction. So one can snore, you can feel tired, you can have a dry mouth. And when they test you, sometimes you do need a machine to help you sleep. And that is reversible too with the machine, of course, weight loss. And I think which we don't give enough importance to is arthritis. Arthritis, an example I always say is when you have a newborn, 5 or 6 pounds, how long can you carry that newborn around? You do want to put that baby down. So imagine that much excess weight you are carrying around if you're 20 to 30 pounds overweight, obese, over time. So obviously your body will give in at some point. So even I've had patients who are 75, 80 who are really committed. Some I've used medications to treat them, help them treat their weight loss, some just pure lifestyle changes. And just the 10-pound weight loss, they just say how much better they feel. So with all of this being said, I feel like we have to start understanding obesity more as a chronic illness. There are a lot of taboos because there's a social aspect to it, there's a behavioral aspect to it, there's an emotional aspect to it, and there are medical aspects and physical and physiological. So it's not, we all know it's not easy to lose weight. It's much easier to gain weight, but it's also possible and doable with change in our behaviors. And I always say the easiest way, even still not easy, is to pick one small thing every week and change that. Whether you are, it's surprising to see how many people think they eat correctly, but they don't. Even amongst Asians, especially many of us are vegetarians, we tend to have a very high carbohydrate diet. So gradually studying more and understanding what are the correct types of foods to eat, what are the correct lifestyle choices to make is a journey in itself. But if I have 75 and 80-year-olds who have done it, I think any one of us can do it, because it's just a matter of wanting to do it and having the desire to do it and desire to live longer and healthier for your family and yourself. So I can speak so much longer on this because I'm so passionate about this topic, but I think my time is limited. Is there anything, Jaya, that you would like me to touch upon or that has been on your mind as I speak about this?
Yes. So do you have any program as such where women can join?
So there are many programs around to help in weight loss. I do not typically recommend programs which particularly sell their products for particular diets. I do like programs like Weight Watchers, and there are other programs like MediFast clinics, which actually help with particularly women who have severe obesity. Most of the time, though, the reason why I say that is a lot of the programs that where you buy and you have to commit to buying their products or food, you can do it for only so long. So it really doesn't change the underlying main issue, which is behavior. So any habit, and everybody knows this, there are many books on habits. It takes a very long time, 21 to 30 days minimal to change any habit. So if you've been eating a particular way throughout, it's not going to change so quickly. But a lot of programs, example is Weight Watchers. I mean, I'm not committed to Weight Watchers in any way, but they just teach you how to eat correctly. There are many weight loss clinics throughout, and there are many that are run by physicians also. And again, a lot of those clinics, rightfully, sometimes we need to prescribe. Example, we in Griffin Hospital, we have obesity clinics set up, and we do prescribe medications because we know that for a certain amount of weight, just pure lifestyle changes and even medications can only get you 20% down, which is good because it's better than what one was before.
Yeah.
But if you want to get to an ideal weight, sometimes surgery is required. And even though I try to shy away from it, most of us, we try to, of course, nobody wants surgery, even though that's very typical, but those are options that are also there.
Thank you. Do you have your own program?
So yes, I mean, I am employed by Griffin Hospital. So our hospital per se, yes,
Okay.
we do have a program.
Okay.
I myself and a few other doctors, we work together and we see patients, and then we, if necessary, we refer to the surgeon, and we have a nutritionist, and we have a group of people who can help patients.
Thank you